Hello and hi everyone. I'm Dr. Naeem. Welcome back to my channel. Today we are going to talk about a commonly misunderstood neurological condition called Tourette Syndrome, often shortened to TS. Many people think Tourette Syndrome only means shouting rude words, but that is not true for most patients. In this video, I will explain what Tourette Syndrome really is, its causes, symptoms, diagnosis, treatment, and how people with TS can live a full and normal life.
What is Tourette Syndrome? Tourette Syndrome is a neurological disorder that usually starts in childhood. It is characterized by tics, which are sudden, repetitive, involuntary movements or sounds. To be diagnosed with Tourette Syndrome, a person must have both motor tics and vocal tics. These tics must last for more than 1 year. Symptoms usually begin before the age of 18. Tourette syndrome is not a mental illness, and it is not contagious.
What are tics? Tics are divided into two main types. 1. Motor tics. These involve movements of the body, such as eye blinking, facial grimacing, shoulder shrugging, head jerking, hand or arm movements. 2. Vocal phonic tics. These involve sounds such as throat clearing, sniffing, grunting, coughing, repeating words or phrases. Only a small percentage of people with Tourette syndrome have coprolalia, which means involuntary swearing.
Why does Tourette syndrome happen? Causes. The exact cause of Tourette syndrome is not fully understood, but research suggests it is linked to abnormal brain signaling, involvement of areas controlling movement and behavior, imbalance of neurotransmitters such as dopamine. There is also a genetic component. TS often runs in families. A child has a higher risk if a close relative is affected. Tourette syndrome is not caused by bad parenting, stress alone, or emotional problems.
Common associated conditions. Many people with Tourette syndrome also have other conditions, including ADHD, attention deficit hyperactivity disorder, obsessive-compulsive disorder, OCD, anxiety disorders, learning difficulties, and sleep problems. In fact, these associated conditions often cause more difficulty than the tics themselves.
How is Tourette syndrome diagnosed? There is no single blood test or scan for Tourette syndrome. Diagnosis is usually made by a GP, a pediatrician, a neurologist or child mental health specialist. The diagnosis is based on clinical history, type and duration of tics, excluding other causes. In the UK, children are often referred through NHS CAMS or pediatric neurology services.
Treatment options in the UK. There is no cure, but symptoms can be managed effectively. 1. Education and reassurance. Many mild cases do not require medication. 2. Behavioral therapy. The most effective therapy is CIBT, Comprehensive Behavioral Intervention for Tics, available in specialist NHS services. 3. Medications. If tics are severe, dopamine-blocking medicines. Alpha-2 agonists, example, clonidine. Number 4. Treating associated conditions. Managing ADHD, OCD, or anxiety often improves quality of life significantly.
Living with Tourette syndrome. Most children with Tourette syndrome improve during teenage years. Many have minimal symptoms in adulthood. Support at school is very important. Teachers should understand tics are involuntary. Extra exam time may help. Bullying must be addressed early. People with Tourette syndrome are intelligent, capable, and can succeed in any profession.
Tourette syndrome is not behavioral. It is not caused by stress alone. People cannot just stop their tics. Understanding and support make a huge difference.
Tourette syndrome is a neurological condition, not a weakness. With early diagnosis, proper support, and understanding, individuals with Tourette syndrome can live happy, productive lives. If you found this video helpful, please like, share, and subscribe to my channel. I'm Dr. Naeem. Thank you for watching.